morning, Atlanta. I'm Dr. Mary Parker here with the Mary Parker Foundation, and today we are entering our last series. Our series for this quarter will be about Medicare, Medicaid, the Advantage plans, the various insurances that we can go to. And we have two experts within the industry that's going to bring so much information to us today, and we'll be able to make more informed decisions after this discussion today. I am so happy to introduce to you Leslie and Austin McGuffie, and they are from Access Benefits Consultants. What does that mean? It means they know all about all the benefits and all the carriers. So I want to just encourage you to buckle up, get ready, because we're getting ready to have a very live conversation during this open enrollment period. From now until December the 7th, you will have an opportunity to choose the service providers that you want. But because of the conversation today, it is our desire that you will be filled with far more information and equipped to make a more empowered decision. So again, thank you for being with us here at the Mary Parker Foundation. And we are coming to you live from Junction 2800. Leslie, if you will please introduce yourself and tell us a little bit about you and about the company. Then Austin, we're going to come over to you for the same response. Thank you.
Of course. So my name is Leslie McGuffie. My husband and I, Eric McGuffie, started Access Benefit Consultants in 2019. It is an insurance agency. We specialize in Medicare, but we also represent carriers for life insurance, retirement income products, individual health insurance for those who are under 65 or who do not have Medicare. We represent all or most of the carriers here in the Georgia area. We also have agents in other states like California, Virginia, Ohio. And we just really put people over profit. We believe in really helping and giving our clients one-on-one attention. We make sure that the plan that we help them select is right for them, because everybody's needs are different. People take different prescriptions, they have different doctors that they have to see. Some people are very fit on one extreme and then some are very ill on another extreme. So there's no one size fits all type of plan. We represent Supplement, Medicare Supplement, Medigap, and Medicare Advantage plans. And so we just want to make sure that we treat our clients like family. We actually have a team of agents. We have about 200 agents around the state of Georgia and around the country who also provide that level of service to their clients. And it's important for us to partner with really with agents who have character, who have integrity, and treat people like people. So that's who we are. Austin is my son. He's my third son. My husband and I have 6 sons, most of whom are involved in the business with us. So we are a family business as well.
Oh my God, I would love to be in your household. I tell everyone all the time, I should be a boy mom. I have 1 daughter and 3 girls.
Wow.
I love them dearly, but I would love to have a boy to neutralize things in our home.
Yeah.
This is a great thing that you are doing, and we appreciate having people like yourself who can come to our communities and share with us the impact that these benefits create for organizations or for communities who are not as aware.
Right.
And Austin, I'm going to come to you with a 2-part question. First, how do you like working in your family business?
So I ran from it for a long time. I didn't want to do it. But as it turns out, my own interest developed into health and wellness. So I was a personal trainer before working with my parents, certified health coach, nutrition coach. And so as I was navigating that space, I stumbled across what are the social determinants of health. And that's access to healthy food, access to education. And there are 3 others I don't remember off the top of my head. But those, they really impact us at a societal level. And after I started learning more about the benefits that are included in these insurance plans and how they can really enhance people's lives and combat some of those health disparities, it makes sense for me to kind of take all my talents that I've garnered on my own. I wouldn't say on my own, but some of the talents that I helped to nurture and then to bring it over to work with my parents. So it's pretty cool. It's you get a chance to spend more time together, which is fun. Yeah, it's fun.
And where are you in the lineage?
So I'm third out of 6. Yeah.
Love it. I'm number 2 of 9 children, and it's 6 of us girls.
Wow.
We do have 2 brothers.
Wow.
Yeah, so 8 of us are making decisions together, if you can imagine.
Yeah.
So being a Gen and watching your parents as well as the community, when you look at Medicare, and we're going to talk Medicare and Medicaid for this point,
Mhm.
how do you interpret that? And how do you explain that to people who don't know?
Yeah. So I always let people know that if you are enrolled in Social Security, unless you fall below a certain income, you're going to be paying $174.10 every month to Social Security. And I always start there because that number is coming out of many people's Social Security checks, and they don't really understand why. So that $174.10, it pays for your Part B, your Medicare Part B, which gives you access to doctors and many other things that are encompassed within Medicare. But I start there and I let people know that, hey, you worked for these benefits if you're receiving them. I am currently paying Social Security tax. I pray to God one day that I'll be able to benefit from it.
Well, you know, that's really interesting because I read where by 2033, the benefits are going to be gone.
Yeah.
And I'm going to come back for your opinion
Mhm.
about the amount of money we're spending for the Advantage plan that's not being utilized.
Right.
Where is that money going? Hold that question for later.
Mhm.
Now, let's go back to one of the things, what you were going to answer.
Honestly, I don't even remember what. I was
Okay, then
gonna
we're
answer.
gonna go to your mom. This is great. I mean, it's because, you know, where your mom and dad miss things as they're growing
Oh, right, yeah.
into the population that's going to have more people.
Mhm.
Unfortunately, or fortunately, I'm in that category as well.
Fortunately.
We just don't know. I'm going to ask you some other questions, but please explain to us the difference between Medicare and Medicaid.
Okay, it's very simple. Medicare is earned when you are either over 65 or you're disabled and you have Social Security disability income. Okay. Medicaid is additional assistance if you fall below a certain income parameter. So if you are low income, then you might qualify for Medicaid and you would apply to the state for that. So that assists some people with their Part B premiums where they do not have that Part B premium taken out of their check if they qualify for Medicaid. If they qualify for Medicaid, they can also get onto some of the Medicare Advantage plans where they have low or no copays and some additional benefits like dental, higher dental, maybe. There's, you know, the popular thing now is food cards. When I started in 2014 and 2010 selling insurance, Medicare Advantage plan, there were no food cards. There was no dental even. Everything had copays. There weren't even any dual eligible special needs plans and for people with Medicaid. So everybody had copays at that time. Nobody had dental coverage. Nobody had vision coverage, but at least they had some kind of additional coverage. Because with original Medicare only, you're responsible for 20% of all of your bills. Everything that any bill that you would get at the hospital, any doctor, provider, Medicare pays 80%. And so that means there's 20% left. And if you don't have a Medicare Advantage plan and you end up in a hospital for an emergency or a heart surgery or any kind of procedure, then you're going to get billed 20% of all of that. And I've seen people, I've gone to their homes and sat at the kitchen table and they come to the table with a shoebox full of bills and they can't pay those bills.
So with that in mind, how do you determine, and there must be some factors that we use to determine which plans to get. So for a person who is 65, 67, and they've maintained good eating habits, they haven't lived in the deserts, and they exercise regularly with their vitals average to below average or above average. How do you explain to individuals like that the best plan for them? Austin.
So again, it really depends. This is a good opportunity to bring up what's called a needs analysis. That's something that we do with every single one of the people that we sit down with. That's where we review your income. It's where we review, again, the prescriptions that you're taking. We usually sit down for about 30 to 45 minutes, just asking questions to understand more about our clients. So it's very difficult to say what would be the best plan. Actually, it's non-compliant to say what would be the best plan. But if I was sitting across somebody who maintained great eating habits and exercise often at 65 or 67, I would probably recommend what's called a give back, a Medicare Advantage give back plan. These are plans that have $0 premium, and oftentimes they reimburse you for that Part B premium. So that $174 that I mentioned earlier, some of the health insurance companies, they'll give anywhere between $60 and $160 to pay down that portion of the Part B premium. For someone who has been eating healthy all their lives and who still exercises, your healthcare costs may be a little bit lower because you're not needing to see the doctors that often or go to hospitals. And in that case, you're not going to use those benefits. So it makes sense to choose a plan that would, reduce your Part B premium costs. And I guess that's their way of rewarding you for being a healthy citizen.
That's a good thing if we know about it and know how to access it. Leslie, I'm sorry. You want to elaborate on that a little bit more?
Absolutely. So you use the keyword there, access, which is why we named our company. We really want to provide access to people with information, with education, with care and concern. It's important that you find a really good insurance agent who cares about you individually, who can sit across from the table and converse with you, not just about financial things or insurance, but just about you, like what's going on in your life. How's your health? Now, compliantly, we're not supposed to ask you health questions because, of course, we can't cherry pick, right? Insurance companies can't say, oh, I want this healthy person, but I don't want that person who's not healthy. But we do care. Within our agency, we do care about how you're doing. How's your family? How's your dog? How are your grandkids? Are you enjoying life? Are you getting out there? Are you involved in anything? And we get a really good sense of who you are. It's also important for us to share who we are. And that's why I like to tell people that we have a family business, because it's not just one person, it's not just two people, husband and wife. Now we have our sons, involved, and our daughter-in-law now, Austin's wife, is really involved in helping us plan our events and things like that. So knowing who we are and now knowing who you are, then we can explain to you how to get access to the right plan for you, the right benefits for you. And if you're telling us that, I'm healthy, I go to Silver Sneakers, I go to the gym, and I eat, healthy, and I take my herbs and supplements, then you might not need or want to have coverage for, more things that more people like would be, like insulin. You don't need that, right? You don't need a special needs plan. So you might just want your Part B premium back in your check so you can spend it how you want to.
Let's talk about the Part B premium. How many of you in this room who are on 65 or older benefits, that you thoroughly understand your plan and that you have no more questions? Let me see a raise of hands, show of hands. No one showed their hands that they understand the programs, and I'm included in that number.
Yeah.
I don't understand it.
Yeah.
Because it's working people,
Yeah.
in many cases, who understand about paying our bills, eating healthy and the likes. And when we do that, and we call Social Security, that's typically where we start for lack of awareness that you're here. And they give us a spiel, and I leave the line thinking that we have two companies working in conjunction. I don't think I need the Advantage plan, but I don't know how to conduct the needs assessment to make that determination.
Right.
So can we talk about that?
It's different. So, you mentioned people who work a job and you know what kind of benefits you have on your job from your employer's group benefits, right? When you age into Medicare and you go into Medicare, it's entirely different. Just because you have one carrier, let's say you might have Blue Cross as an employee, Blue Cross with Medicare is going to be different, right? So you need somebody to explain that to you. And to your point, when you call Medicare and you get somebody on the phone and, they're trying to
get someone on the
well,
phone.
after a while, you're full. Then you hang up and you still really don't understand it because it's very, very complicated. And then you might even have an agent that's face to face with you. We sit face to face, like Austin said, like an hour, sometimes 2 hours, even when it's a couple. They have a lot of questions. And so you can leave the house and then a week later they're calling and say, wait, what did you tell me about this, that, and the other? But what's awesome about that is you have somebody you can call throughout the year when you do have a question. Because 6 months down the line, when you have to use your benefits, you're not gonna remember. I wouldn't remember, you know what I mean? What you told me that day. But if you have somebody that you can actually call and they actually pick up the phone and it's a real person, not a chat bot or, AI or something like that, it's really important to have that information and that access to somebody, a real person.
Yes, during this administration, we have experienced a lot of changes, increase in benefits for many. But we're now at the end of this administration. What are some of the concerns organizations such as yours have as we venture into an administration that's not as friendly with benefits and other things? So from a Medicare and Medicaid perspective, I would, and I believe our audience would be interested in your views as we move forward.
That's tough. Honestly, as far as our business is concerned, I don't think that either administration has committed to the reduction of benefits through Social Security or reducing benefits through Medicare. In fact, so far it's been quite the opposite. So many of the changes that have been happening to Medicare are rooted in being more preventive. So as she mentioned, years ago, it was just if you needed to go to the doctor that you use your health insurance plan. Now, there's interesting things happening in Washington. There was actually recently a roundtable discussion with many senators where they talked about what's called the metabolic health crisis. And that is all things that are that end up as a chronic disease. So diabetes, high cholesterol.
So you're talking about the 4 deadly diseases that occur within our community: cardiovascular, hypertension, cancer, and diabetes.
Yes, and all of those are all stem from the same root cause, which is our food system, which is our elevated levels of stress in our community, our lack of access to healthy food. So what we're seeing now, and this is the shift that I personally love, many health insurance companies are infusing more preventive care benefits into their plans. So you can have access to things like acupuncture or in-home support, respite care for caregivers who are burnt out at home. So these are aimed at reducing our need for prescriptions in the long run. And those are the changes that I foresee with Medicare that I don't know that are necessarily dependent on the administration that's in office. Although these are tumultuous times and we can never know what to expect when there's a new administration coming in. But the trend that Medicare is going, from my perspective, it seems that our governing bodies are understanding the root cause of why we're so sick, and they're attempting to address it by providing more living benefits in Social Security and Medicare plans.
That is a great answer, Austin, and thank you for your involvement. Because you're right, this is a preventive that we're looking at, and even here in our community, when I came, I didn't even really have a thorough understanding of what a food desert was. Well, once I learned that we were in a food desert, I immediately understood that we're in multiple deserts here in the Campbellton Road corridor. The fact that we're bringing this kind of information to the corridor, I can see where eventually people are going to become more wise in selecting their plans. You mentioned trend, and I heard it clearly. Are there other trends that we may want to look at that are occurring between, let's say, 23 and upcoming 25?
Yeah, maybe you should talk about the Inflation Reduction Act. And
that was one of them.
Well, yeah, that's the first thing that came to mind when you mentioned about the government and the changes. So recently there was the Inflation Reduction Act, which made the coverage gap or donut hole, those terms might be familiar to some people, go away. So there was a cap on how much coverage you would get for your Part D prescription drugs. And then once you reach that level, that high level, then your coverage dropped off, essentially. And then you'd be paying more for your prescriptions. This year, that number was 25%. You were paying 25% of the cost of your drugs in that coverage gap or donut hole. So fast forward to 2025, that goes away. Your entire cap is $2,000 worth of prescriptions annually. So that has helped tremendously the community, and the current administration is responsible for instituting that. And so also what they've instituted is the cost for insulin has dropped to $35 at the most per month for a 1 month supply of insulin. Typically that could have been a couple $100 previously. So there are regulatory changes within the government that has helped seniors and Medicare beneficiaries along the way. And consequently, it changes our industry and our business as well, and how we have to operate, because then the insurance companies make an adjustment. If they have to spend more money on your prescriptions, they're going to decrease some of the benefits within the plan. So you may have had $3,000 worth of dental coverage this year. That may drop down to $1,500 worth of dental coverage next year. And so that's why you kind of need somebody to help you understand the differences in the plans, because it's very, very complicated and it changes from year to year sometimes.
That's why you're here.
That's why we do what we do.
And it's very, very important work that you're doing. Let's give them a hand of applause for what they're doing. And you partially answered something I often think of, and I alluded to it with one of your questions. But this access from one category of benefits, are you saying that if I have a cap of $2,000 per month, per year for prescriptions, and I have a $3,000 benefits for dental, if I don't use all of my dental coverage, I can now use these benefits? Is that what you're saying?
Wouldn't that be nice? No.
Oh, okay, I'm glad I asked the question this way. I was getting very excited, not just for myself, but for this entire community.
Wouldn't that be nice? You get a bonus for not using your plan, but no,
Well, wouldn't it be great? Because we've already paid for those
It
services,
will be
right?
great, but with the insurance companies, they have the clients that don't use it, and then you have the ones that overuse it. So it sort of balances out for the company. They're responsible to their shareholders. They have to have a profit. In order for them to even stay in business, they have to have a profit. So that's what we're dealing with, capitalism at its best.
Yes. That is wonderful. Here's one I really want to dive into a little bit more, and that is the open enrollment period. We believe, and I believe this is true with most, that whatever we sign up for that upcoming year, we cannot change it after December the 7th. However, I did a little bit more research, and there is an extension that we can apply. I believe it's up till March of the upcoming year. Can you address that? And I understand why we have open enrollment. Open enrollment is so that if you're not satisfied with what you had last year, you have an opportunity to change that for what you believe is going to be better for the upcoming year. If you're unsure, again, I would like to refer you to our guests today, Leslie and Austin McGuffie, and their benefits management consulting companies. And let's talk a little bit more, Austin, about those benefits.
Yeah. Well, let's go into, so there's a difference between the annual election period and the open enrollment period.
Annual election.
AEP and open enrollment period.
What's AEP?
AEP is where we're at right now. This is the time of year where everyone chooses their plans for the following year. So between now and December 7th, you have
annual enrollment period.
Annual enrollment period.
Okay.
And that is to select your plan for 2025. Now, that open enrollment period you talked about is important because that gives you an opportunity to test out your plan, to understand how the benefits work, to see where your prescription drug costs may be for those first 3 months of the year. And it gives you a chance to change your mind, because you're right. The plan that you select for 2025, for the most part, is the plan that you're going to have all year. So that January to March period of time is where beneficiaries have an opportunity to test drive their plan, make sure that it, all the bells and whistles work for them and that it's going to be good for them throughout the rest of the year. Now, those are two of a few election periods throughout the year where people can choose plans. There are a few more if you happen to move to a new county where there's different plans. At any point throughout the year, that gives you an opportunity to look for different Medicare plans as well.
So relocation is an exception to the rule.
Yes, relocation is. Having a chronic condition is an exception to the rule as well. So for those who may be diagnosed with a chronic condition midway throughout the year, and you need a plan to tailor more specifically to that chronic condition, then you can have an opportunity to choose that plan throughout the year as well. Those are going to be two of the main ones.
If you get Medicaid,
Oh,
or
true.
if you lose Medicaid, that's another election period.
How do you lose it?
Sometimes people inherit money and then they lose Medicaid.
Yeah.
Okay, let's talk about that. I heard you talk about the income level earlier. Address that, please. So I'm currently in this community because zip codes matter as well.
Yes.
I'm currently in a 30311 zip code. When I became eligible for Social Security and Medicare, I chose a particular plan.
Mhm.
But the end of that year, I was diagnosed with cancer. This is a hypothetical.
Okay.
So you're saying that I can now change my plan upon discovery to a different plan,
Depending upon the condition.
depending
So
upon the condition.
currently, there's no special needs plan for chronic conditions for cancer in our area.
Ah,
So diabetes and heart disease, end-stage renal disease, and dementia, I think are the only ones currently that are available to roll into for 2025.
so how can cancer be one of the primary killers within our community not be part of the benefits?
It may be because cancer is not considered a chronic condition, chronic meaning ongoing and consistent condition. For instance, like diabetes is something that, once diagnosed, you typically have
Lifetime.
until, yes, chronic.
Also, you mentioned being in a capitalistic society and cancer is very expensive to treat. And I could imagine for a company that wants to maintain profitability, I don't imagine they will market specifically towards that demographic. As wrong as that is, it may seem,
Yeah,
that's, it's the country where we live in.
okay. What about people who have an illness such as cancer that is not covered with specialty? Are there additional plans that these individuals can incorporate with their Medicare that would reduce their costs?
So we do have an insurance called cancer insurance. However, you would have to purchase that prior to being diagnosed. Once you're diagnosed, then you're not able to qualify for a cancer policy. But if you had a cancer policy, those would reimburse you up to a certain amount depending upon your coverage if you are diagnosed. And then you could use that reimbursement however you need to. Sometimes if you need expensive chemotherapy. On most plans, chemotherapy is 20% coinsurance for the beneficiary. 20% of whatever that cost is.
And
Up
that
to
could be
the-
horrendous.
Up to the maximum out of pocket. So with Medicare Advantage plans, there is usually a maximum out of pocket. It ranges. Sometimes it's $6,700. Sometimes it's $9,300 a year. Sometimes it's $5,500. Either way, that's a lot of money for
That's
most,
not being used, so
for
to
most
speak.
people, right? But if you have a cancer policy that could reimburse you, then that maximum out of pocket won't hit your pocket as hard, right? So, but again, like I said,
But
have
you're
to purchase
weighing-
that. That has a premium, so you're gonna pay a
Yeah.
monthly premium for that policy to protect you. Here's the thing though, you have a 50% chance of being diagnosed with cancer in this country, and that's just nationwide. In our community, it might even be higher, right? So cancer insurance is not a bad buy. We have auto insurance, we have homeowners insurance.
Some people have pet insurance.
Some people have pet insurance. So, cancer policy is not a bad thing to add to your healthcare and your healthcare coverage, your financial package.
Now, earlier when we began talking, she indicated that these programs are not a one size fit all. What about the coverage for cancer, for those additional policies that we want to, that we may, that we may decide to include in our medical plan? What is that based on income again?
Pretty much, like what can you afford, right? So, we represent several companies who have cancer policies for you. And we have tools that we can use where we would enter your information, whatever monthly amount that you can afford, and then we can tell you how much coverage you would get for that. So.
Wow. Any questions from our audience? Any questions online at this particular juncture? Okay. Austin, there must be a lot of other things that you would like to say that I may not even know to ask the question.
Mhm.
So why don't you just take off and begin sharing any information that would help this community and any other communities make the best informed, financially sound decision for their health?
Yeah, I would urge people to not look at their insurance plan as a means of what if I get sick, but more so, how can I use this tool to make me healthier, to give me an improved lifespan. So, and much of my time sitting with seniors over the past year, I've probably sat at over 100 dinner tables with different clients of mine. And one thing that I've grown to appreciate is the importance of quality of life in general. And I think that especially working in the 65 and up population, they have somewhat gone unnoticed, forgotten a little bit. The remaining life that they have left is a bit discounted. And that kind of rubs me the wrong way a bit. So looking at plans that can help you with purchasing healthy food, that gives you access to gym benefit to use, that rewards you for getting certain screenings done to make sure that you're not, trending in the wrong direction as far as your health is concerned. That's something I'm personally passionate about, and I urge each of my clients to leverage that plan. That $174 that everyone is spending a month, I tell my clients to get something back out of that. Get some return on investment for the amount of money that you're spending and the amount of time that you spend paying taxes. Get something back that's going to truly add some quality of life to the years that you have remaining.
I love it. I love it. Thank you, young Black man, for being in this field. We need you. Our community needs you. So when mom and dad retire, the information will continue to flow.
For sure.
Through the lips of those you have prepared well.
Absolutely.
Yes. What would you like to pick up, Leslie?
I would like to introduce a topic about health and wellness because I became a certified health coach myself a couple of years ago. It's been my passion to live a healthy life. My father died when he was just 56 years old. And so I was about 30. He had a heart attack. And ever since I was about 30, I've been really in tune with my body. I think it's really important for us as a community to be in tune with our bodies, especially as women. We need to know every little nook and cranny, every little symptom or anything that we feel. We need to understand and research and learn and improve and grow. We always need to analyze ourselves so that we can age very well. I'll be 59 this year, and I didn't know what 59 was going to feel like. When I wake up in the morning, sometimes aching, I'm like, "Ooh, what have I been doing all night in my dreams?" And then I remember, what did I eat that night? What did I eat that day? Did I just sit down all day? You know what I mean? It's just really important that we make good choices because we feel them more as we age. And so when I became a certified health coach, I was also going through, and can I say menopause?
Absolutely.
Okay.
We talk the truth here.
So I was in the throes of menopause and I didn't understand. This was before they started talking about it, right? I've been going through this for like 8 years now. And so now I'm like, oh, now that I figured it out, now they're talking about it in the news and everything. So it's just really important. The overarching theme is get to know your body, know how what you're eating affects you. You know what I mean? What did I drink last night? What did I do yesterday? And then establish a pattern of recognition of those choices so that you can continue don't give up just because you turn 60 years old. And it's like, oh, I'm just gonna give up. No, I mean, you just gotta keep moving, right? So that's really important to me now. And we want to really infuse that health and wellness into our agents, into our clients, and just really to spread the message that health and wellness goes right along with insurance, because we want to make sure we get our screenings, like Austin said. You know, we want to get to the doctors and get our physicals and stay on top of everything. The older we get, the more important that is.
Well, I have a funny story I want to share. Until earlier this year, I lived alone. And I had one of those big birthdays this year. So the running joke in my house is that I can never get up feeling whatever 68 and a half feels like. I can never get up feeling more than 68 and a half. And that's before 11 o'clock. By 11 o'clock, I need to have, by my activities, my eating and all of that, I need to be 55 again for the rest of the day. So that's the running joke in my house. You can get up feeling 68,
Yeah.
69 and a half,
I like it.
but by noon, you've got to get back to your normal self.
Right.
Yeah.
And
And it takes a minute sometimes.
you notice the difference in time. I didn't say what time I get up, but that could be anywhere between 6 and 11 o'clock.
Mhm.
So you're right, it's not a few minutes, but audience, don't deny what you feel. Sister Leslie just informed us to get in tune with our bodies. If there's a spot, if there's an area on your body, say for example, your ankle suddenly begins to ache every time you pick it up, that's abnormal. If it continues, you want to be preventive and find out what's the cause here. Is it vitamin D? Am I not drinking enough water? Do I have some issues developing with my bones? As long as we're self-diagnosing ourselves, brothers and sisters, many times we miss the point. So get away from that, even though you may think it's preventive. Get to know your body, understand where you are in the cycle, and then it's called research. If you're not yet getting Medicare, Social Security, which Medicare comes along with working people, start now. Let that be a part of your decision-making in terms of when you're going to retire. You may need to readjust the benefits or the plans that you currently have that will offer you more protection when you leave the workforce, and you absolutely want to be sure of what those benefits are. And to that point, Leslie, are there things that employed individuals can look at, and when should they begin looking at those plans?
Well, employed people, if they stay employed past 65, they can keep their plan, usually with their employer. But sometimes they do come off and go into Medicare. You just want to get a really good needs analysis from a really good insurance agent. And it doesn't have to be us, but you're going to meet insurance agents out there. And, you know, when we get to be a certain age with wives, you can tell when somebody's authentic and when they have integrity. Just be very careful, because there are a lot of predatory practices out there, unfortunately, and those people are going to reap what they sow. But I just think it's really important to really connect with somebody who's knowledgeable, who's just like you go to a doctor, you don't go to, you know, the gas station and get medical care, right? You go to a doctor who's board certified, you know, who's educated, who's been trained. So that's the kind of insurance agent that you want, somebody who's been doing it, who's, you know, who's out there, you know, knows the providers, knows the hospitals, knows all of the options that you have available to you, and they've been giving good advice to their own clients for years. That's what you want. That's what you want to do.
Wonderful, wonderful, wonderful. This is all great, great information. I feel more empowered now.
Good.
More empowered to be a senior.
Yeah.
How's that? Yes, yes, yes.
That's what we want.
So from our gens, you know, I don't ever say that I feel sorry, but what I will say is I would strongly encourage you all to begin looking at other options and begin planning now to have coverage for your health care that you will need when you reach our golden ages. And so with that, being in insurance, and we know that insurance is a bet, what are some of the things that you would advise the gens to begin looking at from a health protection plan right now, in the event they do not have Social Security and Medicare, all of that? What are some of the things you're seeing and advice you're offering?
So for people who don't have employer coverage, who are not 65, who don't qualify for Medicare yet, there is ACA or the Affordable Care Act or healthcare.gov, or those plans that used to be called Obamacare. Some people still call it Obamacare. Those are available. And what's good about that is they can't look at your pre-existing conditions and deny you like they used to be able to do. It's not cheap. It's still, it's insurance, so it's going to cost a premium. But there are subsidies that help you to pay for that premium, oftentimes depending upon your income, your household size. If you have a household size like my son here, he has 4 children. So there's 6 of them. You have a subsidy, right? For your ACA plan, right? So, we use what I have a subsidy plan, an ACA plan, with a subsidy.
What is the ACA?
So ACA stands for Affordable Care Act. So remember a while back.
Right, I do.
Yeah, remember a while back that for people who don't have employer group coverage on their jobs, and if they didn't have Medicare, how do you get insurance? And a lot of times people just didn't have it, right? Because the premiums were a couple $100s a month. And so you just kind of hope that nothing happens. You navigate life, you try to be really careful and not to need it. But when we had the Affordable Care Act, then that opened the doors for people to be able to get insurance coverage in between those ages. Or even if you have people who have gig economy jobs, they might be an Uber driver, or you might be an artist or an entertainer or something like that, and you just wanted to have insurance. Now you could do that with the Affordable Care Act. And so we also represent those types of insurance plans as well for people who need that type of coverage.
One of the other trends that I'm seeing, and it seems to be increasing a lot more, and that is with our telemeds. For the Medicaid population, how efficient from an insurance perspective is that? And is that something that we should consider doing more of, considering our health? And does it reduce the cost of our benefits?
So I don't think that it impacts the cost of your benefits, but it does make healthcare more accessible for those who can't get to the doctor. It also gives you an opportunity to check in with your doctor more often than if you were to only have in-person visits with your healthcare provider. So you'll see many providers are changing how they provide healthcare. Some doctor's offices offer support in the doctor's office, which is traditional. Then they have some doctors that come to your house and provide care. And then you have others that give you a Zoom link and say, hey, just, let me just look at you. Let me check in on you. And these are all efforts that are being infused into healthcare plans, into our entire healthcare industry, aimed at addressing many of the root causes of our chronic conditions. And one of those is access to quality healthcare.
Absolutely, making us a medical district.
Yeah. And COVID actually exposed how efficient we could be with telemedicine when doing medicine in person wasn't as much of an option. And so it really opened the floodgates for us to begin expanding how we provide healthcare to those. So if you do have an option for telemedicine and telehealthcare from your doctor, I would encourage anybody to take advantage of that.
I would as well. And I also like the in-home care.
Yeah.
It's just another benefit. And I remember back in my grandma's days, the doctor came to the house with a black bag. Well, no one had insurance back then in our community, but it is absolutely a great thing to be able to do that. Now, I just want to, for any guests who would want to remain in contact with you and follow you, please share with us, and they will include that in the chat box. How can people follow up with you? And do you work appointments only? You got workshops coming up? Please share that with us.
Sure. So you can find us a few different ways. Our website is Access Benefits, AXXESS benefits.com. Our phone number is on there. We are real people. You can call us. It's on the website. There's also a form for people to submit if they want to get in contact with us. We also spend a great deal of time out in the community. So we have a partnership with Clayton County Senior Centers. You see us at some of their events throughout the year. many of your senior focus events happening in Atlanta. You'll see a big red tent with the word access on it. That's us. So if you're in the community, you'll find us there. Social media, access benefits for Instagram, Facebook, LinkedIn. Yeah,
We'd like to invite you back.
we would love to be back.
We would like for you to come back and share with the community your services. So let's get together after the show. I'm going to say the following Wednesday, not next Wednesday, because we're all going to still be celebrating next Wednesday. The following Wednesday, and I believe that's going to be like November 14th. Can someone confirm that? I would like to invite you all to come back if your calendar permits, and we will have a health and wellness recognition day or awareness day. We'll then invite the community out and you can share with them the products and services that you have to offer. And perhaps we can get the word out and we'll become more empowered in this Camden Road corridor. Would that work for you all?
Yes.
Very
Great.
Yes. Now that we're pretty much at our wrap-up session, I'm going to do a little recap here. First of all, to our listening audience and those of you who have joined us on Zoom today, this has been an exceptional conversation with the Access Benefits Consulting Group. And it's exceptional because we have a family. We have a mom and her son with about 4 or 5 others in the family running a family-owned business. It is very, very important that this conversation today undoubtedly have taken place with some experts. And with that, we want to continue to learn what the benefits are for us, who's providing them, at what rates are they providing them, and some of the trends that are occurring during this season with Medicare. So again, I want to thank you and we're welcoming you back. We will, for those of you, we will send out information in our newsletter or other resources so that you will be able to come out and meet personally with these 2 individuals. Thank you so very much for being here. And then finally, we are now going to open the floor for any questions that anyone have, and then for you to have a few words of closing remarks.
All right, so we have a question from Gordon Smith. He asks, what ways are you educating children so they don't fall into unhealthy lifestyles, no matter their living conditions?
Oh, that's a great question. Thank you so much for that, Gordon.
So my wife and I, we also run a PE program for our children and their school. One of the things that we incorporate is healthy eating. The thing about educating children to help them avoid those pitfalls is their parents have to be educated. And so in many cases, those conversations are happening with their parents. I've had one-on-one conversations with children about their eating habits. And let me tell you, it didn't go very far because children, for the most part, they don't have the awareness and they're going to eat what's available to them. And so I think the onus is on parents, grandparents, to ensure that our children are growing up in an environment that's got healthy, nutritious food. And a perfect example is when my kids come home, if they're rummaging through the cabinets and if it's loaded with food that's going to contribute to chronic disease in the future, that's what they're going to eat. Versus us having fruits and light crackers or whatever the case is. I try to bake chicken wings and cut up cucumbers and carrots when they get out of school. That way, the healthy options are the first option, and the first option is more than likely going to be what they go with. So it always starts with the parents, and then the second is the grandparents. You guys have a lot more influence than you guys realize. And then,
You have to give them treats.
I mean, we give them
So
treats.
they can't give them treats at home. That's a benefit for us, right?
Yeah, because they're going to find the treats out in the community too, with the friends and all that other stuff. But your home really has to be, it's got to be a safe haven.
Intentional.
It has to be very intentional. Yeah, it all starts in the home.
Great answer.
Yeah.
All right, our next question is from Reggie. He says, I've been hearing about compensation of family members to support and take care of elderly family members. A lot of people are not aware of this. It can be a good solution to not lose your income and take care of a family member. How do you contact for this? Medicare, or who do you contact for this? Medicare?
So no, Medicare doesn't provide benefits for that. There are community resources for that, depending on the community that you live in. We have a relationship with a company here called CareForth, CareForth, that supports caregivers, provides an income for caregivers. There are specific qualifications that I don't have outlined here, but you could probably Google CareForth to get information on what those qualifications are. I do know that one of the qualifications is that the caregiver has to be, I believe, a family member, and that family member cannot have employment or income in order to receive that support.
And it just feels like double jeopardy.
Well, I think what it's designed to do is to help people, because if you have a job, then you're not really available to care for the person that you're supposed to be caring for. And so they want to make sure that they're supporting those efforts, that the person that needs care is actually being cared for and not just, put aside somewhere while somebody's working a job.
Is that conditional? And what I mean by that is, could a person, if the individual doesn't require 24 hours care, or is that the only time they can get paid?
Yeah,
Does it become a full-time position?
yes.
And is that full-time 24/7?
Well, I don't represent the company, but like I said, we have an association with them, and I believe one of the qualifications, aside from, not having a job outside, is that person has to need that round-the-clock care.
Got it.
Yeah.
Okay. Thank you. Great answers.
Trudy from the chat says consultation with a professional is imperative since Medicare is so complex. Please explain how the cost of the consultation is covered.
Great question. So
Yeah.
these costs are actually covered in essence by Medicare. I would say that we work for free in a sense. We don't charge to do consultations. It's free of charge.
To the beneficiary.
To the beneficiary, yeah. But I always like to be upfront about the compensation because nobody in America is working for free. And neither do we. Like she said, I've got 4 kids at home. And I'm lucky to be in a profession where I can provide services for free to the people I'm serving and still be compensated. So Social Security and Medicare, they compensate agents like us to place our clients and represent insurance plans properly. So if I'm out in the community meeting with 10 people, neither of them are going to pay me any money.
Correct.
But if I do help them select a plan and it's the right plan for them and it works, the idea is that their healthcare would improve, and the governing bodies that compensate agencies like ours, that's where the compensation comes in for us. But for the beneficiary, that consultation is at no cost.
So let me clarify. So the government agencies actually pay the insurance carriers
Oh, yeah.
a certain amount of money per member per month, right? So let's just say an arbitrary figure. Medicare might pay United Healthcare $1,000 per member per month, that they have enrolled into one of their plans. And out of that money is how they pay commission to agents like us. So if I were to enroll somebody into that United Healthcare or Humana or Aetna or Anthem or Cigna or Sonder, or I don't want to favor anybody. But if I enroll somebody into one of those plans, then the carrier is the one that pays me, right? So we don't work for the government, we don't work for Social Security, we don't work for Medicare. However, those funds ultimately come from Medicare.
We have an Alicia Cooper in the chat, says thank you for all you guys do for the seniors.
You're welcome.
Our next question. Good morning, my name is Judy. Thank you for all of this good information. My question is, I am a Medicare insurance recipient. It is under the Board of Education, the school system, and the state. Okay, whenever I speak to someone in you all's field, they say, you got the best thing. You agree?
Yes. Yes. You don't want to leave your employer group coverage unless you absolutely know that you'll never want to return.
That's what they said, and I thought it was an idle threat, right?
It's
You
not
can
idle.
leave, you can't come back, that's what they just
You
told
won't
us.
be able to get it back. And most of the time, when you have states, you said you're an educator?
Correct.
Yeah, those are really good benefits that you have, and don't let any other insurance agent tell you
That's what they
otherwise.
say.
Yeah.
Okay.
So, one of my biggest takeaways here today was when you said that if you're in good health and don't really go to or use the doctor, then you can qualify for discounts, is what I heard. Is that correct?
Some, and it depends on the plan, but what the plan we were referring to is called a Part B give back plan. And so,
That's it.
yeah, these plans, you don't even have to be healthy and to not go to the doctor often. The plan is available to anyone who receives Medicare A and B, but it may not be the best fit for everyone who receives Medicare A and B. It just so happens that the way that the plan is structured, it makes sense for some beneficiaries to choose that plan if they're not using the medical benefits in their plan. And so that's when they go and they give back a portion of the Part B premium that you're currently paying at $174.
So I can pursue that with the state and,
You may be able to, at the beginning of every
School
year.
It just
system.
depends on what your employer provides. So, sometimes you might have different options within that group coverage that you can select. And so they're in charge of what options that you have.
Mhm.
They may or may not have a Part B give back plan that you could select within that group coverage.
I got a great question to ask them
I
this
guess so.
evening.
That's great, and thank you, Judy. And I have a final question. I was speaking with someone about my benefits and benefits of some others in the community. And the question was, why do you have advantage coverage and not just traditional Medicare? Explain that to us. Was that what she just asked?
No.
Okay.
Okay, so you do have options when you age in or become eligible for Medicare. You can keep original Medicare only, and then you'd have to have a separate drug plan, right? Because you have to have a drug plan so you don't have a drug penalty later, right? So you have original Medicare, you go to the doctor or you go to the hospital, Medicare pays 80%. Then you start getting billed for 20% of whatever that is, right? Then on top of that, your prescription drug coverage, you'll have a premium for that. And the average amount for that could be, let's say, $50 a month, some less, some more, depending upon what prescriptions you're taking and what kind of coverage that you need. So you've got your 20% of original Medicare that you're paying, and you've got your prescription drug premium. On top of that, then you have a drug deductible of about 500, and this is going up next year to 573, something like that. Okay, for your prescriptions, before your plan will start to kick in and pay for your prescriptions. So those are that's one option. Then the other option is to help you cover that 20% of Medicare, you can purchase a Medigap or Medicare supplement policy. That will have a premium as well. It could be anywhere from $100 to $200, depending on which one you select. Okay, so if it fits into your budget and you don't want to worry about the 20%, you don't want to worry about co-pays, you don't want to worry about hospitalization charges, then you will get a Medicare supplement policy to cover that. So now you've got your prescription premium, you've got your prescription drug deductible, and you've got your Medigap premium. So now you might be paying $150 to $200 a month, $250 depending upon your age, right? Because they go up every year.
Is it age or age and income?
Age, no income, right? So that's your second option to help you with that 20%. The third option is Medicare Advantage, which is a combination of your medical and prescription and your dental and your vision. Because if you choose Medigap or you stay with original Medicare, you do not have dental and vision. That's a separate policy that you'd have to get as well. So now you're talking maybe another $70 for dental and vision per month, okay? So with the Medicare Advantage, see how confusing this is? Because now my brain's
Yeah, and she's the expert.
right. So Medicare Advantage encompasses all of that. Typically, your dental, your vision, your prescriptions, your medical, hospitalization. You don't pay the 20% because now the insurance company that you have your plan with is paying your bills, not Medicare. However, you have a copay. So you may have a primary care doctor copay, you might, or you might not. You may or may not have a specialist copay to see your specialist. You will have a hospitalization copay if you're here in Georgia. But some states like Florida and California, they don't even have a hospitalization copay. You're gonna have MRI copays, you're gonna have the other diagnostic procedure copays, just different copays, right? But you'll also have dental coverage. And you'll have vision coverage if you need glasses every year. You will have maybe a transportation benefit for those people who can't get back and forth to the doctor on their own or to the
And this is
pharmacy.
all under the Advantage.
This is all under Advantage.
One of the other carriers.
If you choose one of the carriers, it's gonna depend, you know, every plan's different, a little bit different. So they'll take you to the doctor's office, bring you back, if you need that. Physical therapy, it'll cover some of that. So, you know, you're having to decide based on your budget, what fits for you. And that's why there's so many different options, because there's so many different people and so many different circumstances.
Okay, and I'm not going to put her on the spot and say, will you narrow it all down and tell us which is the best plan?
Because
I'm
there's
not
no
going-
such
there
thing.
is no such
There's no
thing.
such thing.
Isn't
Yeah.
that a great setup for us? And we're supposed to process it all. Yes, yes. Any other questions about vaccinations, anything like that, how it applies to the Golden Wonders?
So Medicare covers an annual wellness visit. That includes vaccinations. That includes your cardiovascular screening, your diabetes screenings, you know, prostate exams, breast exams, all of that at no cost annually.
No excuse.
Mhm.
There's no excuse.
Right.
Yeah, this is really great stuff.
Mr. Eric McGuffie said this was a phenomenal conversation. Great job, you guys.
We know that guy.
Yeah, and thanks, Eric, for tuning in today. We appreciate you, and we miss you as well. And we want to also thank Kenny Brown, who has been a wonderful partner in this space and helping the community to identify the resources and then those who can present those resources to us. So thanks, Kenny Brown,
Thanks,
for
Kenny
all that
Brown.
you do for the Mary Parker Foundation and for this community at large. And I also want to thank my team. You know, no one gets where we are without having a great team to support us and help build where we are. So thanks, my ladies behind the cameras, Amber and Tia. And I also want to thank some of our diligent participants who are here. Sometimes it's just us, but we appreciate the time that you give to come glean from us and take this information back out into your communities. So thanks, everyone. And any final remarks from you, Austin?
No, actually, I feel like this was very comprehensive.
Very good. Thank you, Leslie.
I would just reiterate to everybody out there, no matter what age you are, whether you're in your 30s, your 80s, just put yourself first. Take care of you. Self-care is not just a trend. You really do have to put yourself first. Minimize your stress, increase your peace, know your body, go get your screening, and eat real food.
Real food.
Eat real food. That's a subliminal message. Eat real food. Get to know what it is you're putting in your bodies. And I would just like to say, we're here every last Tuesday of the month. Our purpose is to bring awareness into various industries that we have identified in this community and beyond are areas where you can improve your knowledge. And we want to help with that by increasing the awareness of benefits, awareness of programs, awareness of our health conditions, and more importantly, access, providing you with access to information, resources unlimited, right here at Junction 2800. So stay tuned, there's far more to come. But we cannot close this session today without reminding our viewers that we have 1 week. And this is by no means an endorsement from the Mary Parker Foundation. Rather, it is my encouragement to each of you who have not voted to please remember to cast your vote on November 5th, that your opinion will be counted. This is a very critical time I'm not telling you who to vote for, but I will ask you to remember the blood that was shed for the rights of communities such as the ones we're representing today. Don't sit this one out. We must exercise the rights that we earned. They were not given to us, the rights we earned to vote. Again, vote, vote, and vote your conscience. Again, stay tuned. More to come here at Junction 2800. Thank you. Thanks, everyone.